As we reflect on PCOS Awareness Month, which took place during September, the struggles persist year-round for the 15% of reproductive-age women who grapple daily with PCOS or Polycystic Ovary Syndrome. Dr. Heather Cook, Reproductive Endocrinologist with Coastal Fertility Specialists, is here today to explore the importance of continued awareness beyond the dedicated month. Dr. Heather, thank you for joining us today.
Oh, no problem.
So, first of all, can you tell us what PCOS is?
Sure. So PCOS is an endocrine disorder, an endocrine syndrome that has multiple parts to it.
Okay.
So one of the big parts is that a lot of these women struggle with infertility. So that is generally when we are seeing them and evaluating them. But there's a whole separate part of it besides the infertility that deals with overall health, where these women are going to have increased risk throughout their lifetime of things like diabetes and heart disease and hypertension and things like that.
What are the symptoms that we should be looking out for?
So normally patients will present as having very irregular menstrual cycles, and so when we see these women, they may be getting a period every 3 months, 6 months, sometimes never. So that's probably the most common symptom that we see. We also see it associated with what we call hyperandrogen, or things that are associated with high male hormones, so hair growth, male pattern baldness, things like that.
Is the menstrual cycle, does it tend to be, more painful for women with PCOS? Or?
It can be. What we see in patients that don't ovulate, like PCOS women, is when they do have their period, because it's only coming every 3 months, 6 months, it tends to be a fairly heavy period for the most part.
Okay, so you mentioned that infertility is the main thing that women struggle with PCOS. Is there anything else other than, the diseases that they're more prone to later in life?
Right.
Infertility, what are the other direct issues that can come from?
So from a fertility standpoint, it's mostly that it's an ovulation issue.
Okay.
And so these women generally are overall fairly fertile. They usually have a lot of eggs and everything is working relatively normally, but they're just not ovulating an egg out every month, which is really nice for treatment because most of the time it's a very simple treatment option where we just need to use medications to allow them to ovulate.
Oh, okay, perfect. So you can still have kids.
100%, 100%.
And can you expand on those treatment options?
Right, so again, it's going to depend on if a patient is actually trying to get pregnant or if there's someone with PCOS who's not trying to get pregnant.
Okay.
So for our fertility patients, generally the mainstay is just trying to get them to ovulate.
Okay.
Sometimes we'll find that there's some other underlying issues that have nothing to do with the PCOS that end in different treatments, but it's usually a fairly simple treatment. If they're not trying to get pregnant, it's just managing the symptoms, trying to get their periods regulated and get their metabolic factors under control.
Have you seen a rise in cases of PCOS over the years?
I wouldn't say a rise, but I think the more awareness, like this, for instance, what we're doing today, it really helps women to come in and get evaluated if they are having some of these symptoms. So we may be diagnosing it more just because more women are seeking care.
Okay, so if someone is concerned that they might be having some issues, whether PCOS or something else having to do with their, with their bodies, where can they go for more information about Coastal Fertility?
So they can go to our website, coastalfertilityspecialist.com. They're free to contact us. We don't need a referral to be seen. They can make an appointment with any of the physicians at our facility. And we'll go over all their symptoms and recommend some basic testing. So hopefully we can give them a pretty clear answer as to what's going on with their body.
Absolutely. Dr. Heather Cook, thank you for joining us and giving us insight on this important
Thanks
topic.
for having me.
Yeah, we're back after this.